While violent crime rates across the United States have fallen over the past 2 decades, violence continues to pose a major threat to the health and well-being of many communities, disproportionately affecting racial and ethnic minority populations. According to the Centers for Disease Control, homicide is the leading cause of death for African Americans ages 10 to 24, the second leading cause of death for Hispanic youth in that age bracket, and the third leading cause of death for American Indian, Alaska Native youth in that age bracket. In response to this persistent problem, the Minority Youth Violence Prevention Initiative was launched. Launched in the fall of 2014, the initiative is a 3-year collaborative project between the United States Department of Health and Human Services, Office of Minority Health, and the U.S. Department of Justice, Office of Community-Oriented Policing. The $3.5 million program provides funding for 9 demonstration projects with a focus on young minority at-risk males ages 10 to 18. The grant also included funding for coordination assistance and evaluation across the 9 sites, a role filled by the Center for Core Innovation. The Minority Youth Violence Prevention Initiative engages public health organizations, law enforcement agencies, and community-based groups in an effort to curb violence and reduce disparities in access to public health among at-risk minority youth. The initiative reflects an emerging body of research and practice that treats violence as a disease, linking public health agencies with law enforcement to approach violence from a public health perspective. The first summit for the Minority Youth Violence Prevention Initiative brought together more than 30 grantees at the DeKalb County Police Training Facility in Lithonia, Georgia. Participants range from police officers to hospital leaders to prosecutors and public health and social service experts and represented the 9 sites selected. At the summit, participants heard from experts about how to enhance their programs with understandings of trauma, youth development, and a number of practical strategies to communicate with practitioners from other disciplines, and how to plan for challenges, implementing and evaluating their programs. They also had the opportunity to share experiences and learn more about the youth they would be serving. The selected sites are located around the country and have programming tailored to the needs of their communities and their targeted age groups. From the problems of truancy, bullying, misbehavior among middle schoolers, to the challenges faced by young adults returning to their communities after incarceration or recovering from violent injury. Responding to local needs in communities across the country and representing a wide range of approaches and collaborations among local hospitals, health and school boards, police departments, various levels of government, and community service organizations, the 9 projects nonetheless share some overarching goals. Reducing violent crimes against and perpetrated by minority youth, ages 10 through 18, improving academic outcomes, reducing negative encounters with police, and working to build mutual understanding between law enforcement and young people, increasing access to public health and/or social services, and improving the coordination and collaboration among partnering agencies. Efforts to achieve these goals have played out in a variety of ways among the sites. Take a look at some of the amazing work happening in the NYVP communities. Collaborations, police engagement, youth development, community engagement, youth leadership, parent engagement, youth mentoring, community education events, stakeholder convenings, community service, public awareness campaigns. In addition to their local work to reduce violence and improve health outcomes, the 9 sites have helped to inform the field by sharing lessons learned, challenges and successes via public awareness campaigns, presenting at national conferences, webinars, podcasts, and monthly newsletters.